Well, the first thing is to sit down with that individual and ask them what's their goal. Okay, you came in here. I'm sure you have some motivation. It's not. Some people come and say, "My doctor said I need to start exercising." Some people say, when I was in college, I used to play football and I was in great shape, and that has passed. So I want to get in better shape." And of course, with everyone, we have to do a medical history. The bare minimum is medical history and then blood pressure, because what happens is when you start exercising, you have the two numbers, the top one is systolic and the bottom one diastolic, just to kind of generalize it.
Yeah.
Both of them actually, when you're doing strength training, they both elevate. So let's say we have a male over 40, and in some of those cases, you even need a physician's release for them to start getting an exercise program. But they walk into the gym and we do that assessment. The blood pressure is very important because a stroke can occur because we know nothing about this person. And so that's the bare minimum we would do with them. But we do more extensive. We do body composition, we look at resting pulse, and we have all these various ranges. So we gather all this information and we explain it to them. And then, what would you like to do?
Yeah.
And the person says, well, really, I want to lose some weight. Some people, I want to put on muscle. Depending on where their age is, the guys that still want to look, they're trying to, in early 40s, and they want to do that. And so we'd more or less give them an overview of basically what it takes to achieve that. Resistance training, I would say the bare minimum that someone should be exercising as far as strength training, it would be twice a week. You can do what we call full body twice a week, and that would be like the bare minimum. 3 times a week is even more ideal. So that part, they got to do some cardiorespiratory fitness or cardio, and we can get very extensive in our facility. We do what's called a submax stress test, and it finds out the maximum amount of oxygen you utilize per minute, and it's called the VO2 max. So we don't necessarily take the person to a max, but we take them to a submax, and we can calculate the max. Now that kind of tells us how fit they are. Like myself, at 65, I'm in the 40s right now, and that's pretty respectable. And they say like a 35-year-old male, if they're at 35, that's okay. So once we define it and we explain it to them, then we design a program around it. Now,